All right, welcome back to The Explainer. Today, we're going to unravel a massive medical mystery. Right now, literally as we speak, there are hidden dangers quietly lurking in the daily routines of millions of adults over the age of 60. We're talking about severe cognitive decline, memory loss, and confusion that looks and feels exactly like early dementia. But what if the source of this mental fog wasn't a disease at all? What if the culprit was sitting right there on your nightstand? Today, we're breaking down the 9 most common medications that could be silently stealing your memory.
Okay, let's dive into this with a story about a patient we'll call Margaret. Margaret was 68 years old and, honestly, she was incredibly sharp. But suddenly, she started experiencing a mental decline that completely baffled everyone around her. Within just 18 months of her doctor adding a totally standard new prescription to her routine, everything changed.
And the tragedy of Margaret's decline was just profound. Her daughter used to lovingly call her the human Google of our household. I mean, she went from doing the Sunday crossword every single morning and remembering every family birthday without even glancing at a calendar to suddenly forgetting what she had eaten for breakfast. It got so bad that she even started getting hopelessly confused and lost, driving home from a grocery store she had visited every week for 20 years.
Naturally, her neurologist strongly suspected early Alzheimer's. But here's the massive twist of this whole explanationer. Her symptoms were entirely drug-induced. Margaret's dementia wasn't Alzheimer's at all. It was her medicine cabinet. When her doctors systematically reviewed her medications and made a few strategic swaps, she was completely cured within 4 months, literally back to doing her crossword puzzles. It wasn't a miracle, you guys. It was preventable medicine.
So how does this actually happen? Let's start our countdown of the 9 culprits with the over-the-counter memory thieves.
To grasp why these seemingly harmless pills are so dangerous, we have to meet the molecular villain of our story. A lot of these drugs are what's called anticholinergics. Basically, this means they block a crucial neurotransmitter called acetylcholine. Think of acetylcholine as your brain's primary messenger for forming memories and just staying alert. Now, when you're over 60, your baseline of acetylcholine is already a bit lower, so blocking it further, that actually physically shrinks memory centers in the brain.
And this brilliantly illustrates the problem. Let's look at number 9 on our list, diphenhydramine. You probably know it as Benadryl. It's in almost every PM or sleep aid out there, and it heavily blocks that crucial acetylcholine. Then moving to number 8, we have proton pump inhibitors, or PPIs, commonly used for acid reflux. Long-term use of these actually stops your stomach from absorbing vitamin B12, which is absolutely essential for brain health. In fact, a B12 deficiency closely mirrors Alzheimer's. And at number 7 is oxybutynin, prescribed for overactive bladders. This one crosses the blood-brain barrier so aggressively that neuroimaging shows it actually shrinks the hippocampus. That's your brain's memory filing center. The good news? There are safer alternatives for all of these that you can easily discuss with a doctor.
All right, let's shift our investigation over to our next group of suspects, common prescription culprits.
The biology behind these next 2 is absolutely fascinating. And number 6, we have benzodiazepines. While they're effective for short-term panic, chronic use essentially keeps your brain's calm-down signal amplified for so long that your brain just halts its own neuroplasticity, its ability to form new connections. Then, at number 5, certain lipophilic statins aggressively starve the brain of structural cholesterol. You know, your brain is nearly 60% fat, and it literally needs cholesterol to form synapses and maintain nerve insulation. Again, doctors can often swap these for gentler alternatives, like buspirone for anxiety or hydrophilic statins for cholesterol.
Just to put this into perspective, 51%. For seniors using benzodiazepines for more than 3 months, studies show a staggering 51% increased risk of developing Alzheimer's disease. The drug that feels totally necessary for calm might actually be dismantling your cognitive health in the background.
Okay, moving right along, let's step into a deeply concerning category, psychiatric drugs and seniors. Get this. A major study tracking patients over 10 years found that cumulative exposure to a drug called amitriptyline causes a 54% greater risk of dementia. And you know what the terrifying part is? It's rarely even prescribed for psychiatry anymore. It gets casually handed out for nerve pain, migraines, or just to help seniors get some sleep. When we break down these psychiatric medications, it really reveals this slow, creeping erosion of the mind. So number 4 is that amitriptyline we just mentioned, which carries a severely high anticholinergic burden. Next up, number 3, antipsychotics. These are often given off-label in nursing homes, not for actual psychosis, mind you, but simply to sedate restless seniors for the convenience of short-staffed facilities, which chronically suppresses their dopamine. And finally, Taking the number 2 spot is paroxetine or Paxil. While most modern SSRI antidepressants are perfectly safe for older adults, paroxetine is the big exception. It has high anticholinergic activity that actively damages short-term memory, unlike much safer options like Zoloft or Lexapro. The real-world fallout from this? 71%. Older adults given antipsychotics purely for behavioral management are 71% more likely to experience worsening cognitive decline within just 12 months. We are literally sedating away their remaining cognitive function.
Okay, we need to pause our countdown right here, because as bad as these individual medications are, we have to ask the critical question that brings us to the ultimate hidden mastermind of this whole mystery. What happens when you don't just take one, but take several of them together?
In the real world, nobody takes just one pill, right? The average American over 65 takes 4 or more prescription medications daily, often from completely different doctors who aren't even talking to each other. When these meds share those memory-stealing properties, they don't just add up, they multiply. It creates this deadly compounding mathematical danger.
So the crucial point is this: the number one threat to aging brains isn't a single pill, it is anticholinergic polypharmacy. That's the invisible multiplier effect of stacking multiple brain-fogging drugs on top of each other.
When you look at the data over a 10-year period, this combined burden literally more than doubles the risk of developing dementia. A high anticholinergic burden results in a massive 120% spike in dementia risk. That is double the normal risk, purely from pills that patients were never even warned about. Let's make this real. Imagine a hypothetical patient. Let's call her Dorothy. Think about her normal daily routine. She takes a Benadryl PM to sleep, oxybutynin for her bladder, amitriptyline for some nerve pain in her feet, and a quick, over-the-counter heartburn pill. Every single prescriber thinks their one specific pill is perfectly safe, but together, Dorothy is stacking multiple anticholinergic burdens. Her brain is being absolutely starved of acetylcholine, and not a single doctor or pharmacist has sat down and done the math on her behalf.
Okay, take a deep breath, because here is the good news and honestly the most hopeful takeaway from this entire investigation. Because of neuroplasticity, your brain is incredibly adaptive. It's resilient. Drug-induced cognitive decline is very often fully reversible. Once that medication burden is identified and lowered, the fog lifts, the memory returns, and people's personalities reemerge.
You absolutely have the power to take your brain back. Here is your concrete 5-step action plan to systematically lower that medication burden under proper medical supervision. Step 1. Write every single thing down. Prescriptions, over-the-counter stuff, supplements, the whole shebang. Step 2. Look up your medications on the free Anticholinergic Cognitive Burden or ACB scale online. Step 3. Schedule a dedicated medication review with your primary care doc. Step 4. Ask them specifically about deprescribing. That's the intentional process of safely tapering off unnecessary meds. And Step 5. If your doctor brushes you off, get a second opinion. A geriatric pharmacist can literally be a lifesaver here.
Well, we've covered a lot of ground today, but it really all boils down to this. Are your medications quietly stealing your memory, or are you ready to take your brain back? It's time to open up your medicine cabinet and do the math. If a pill you've trusted for years has been secretly causing brain fog, what else might be hiding on your nightstand? Let us know your thoughts and experiences in the comments below, and start asking the right questions. Catch you next time.